Hello. Today we're going to be going over best practices on how to fill out a certificate of medical necessity or a physician certificate statement. What are these terms? Certificate of medical necessity is abbreviated CMN and a physician certificate statement is abbreviated PCS. What are those things? Well, those two terms are interchangeable. So, whether an organization uses a certificate of medical necessity, CMN, or a physician certificate statement, a PCS, they mean the same exact thing. This document is needed when you have a patient, a Medicare or Medi-Cal patient, going from a higher level of care to a lower level of care. Let's go ahead and define what medical necessity is. Medical necessity for an ambulance ride to be covered by Medicare or Medi-Cal guidelines is established when a patient has a medical condition that requires the use of an ambulance as the only safe and appropriate means of transportation. Any other means of transportation are contraindicated due to the patient's medical condition. So, let's look at the document itself. The document starting at the very top has the patient's name. We need the patient's full name, John Smith. Make sure we do not use abbreviations like J, Smith, or J. S. Must be the patient's full name and their date of birth. This is a very important section that's commonly missed by the pickup location. Make sure we don't use the hospital abbreviations. We must have the actual name of the hospital. For an example, Palomar Medical Center, Room 768, 22185, Citricado Parkway, Escondido, California, 92029. We abbreviate Palomar on some of our run forms as PMC, but make sure on this document that you have the actually full name of the hospital. Same with the drop-off location. We might use TMC as Tri-City Medical Center, but in this document, it needs to be written out fully as Tri-City Medical Center. Room 117 and the address 4002 Vista Way, Oceanside, California, 92029. And make sure the date section is the date of service. If you are able to find their Medicare and Medi-Cal number, that would be very appreciative if you can write it down there, but it's not at the end of the world if you don't have it on there. The top section is the only part our EMTs can fill, but preferably we would like the sending facility to fill this whole document out. The bold section right below this, it says facility staff use only, so the EMT cannot fill out below this line. So make sure each part is filled out by the facility. We will now walk you through how this sheet is supposed to be filled out. Again, this section below the bold line must be filled out by the patient's authorized representative. Transport destination must be properly marked and what level of service was used. So they need to fill out the box with a higher level of care or a lower level of care. Our ambulance company does BLS and CCT. So the marked boxes should be BLS or CCT. Even if it meets the ALS criteria, it should be marked CCT. Now, let's move on to the diagnosis. What diagnosis do we need? We require the patient's acute diagnosis at the time of discharge. This must be a specific and clearly written diagnosis. Unacceptable diagnoses include vague or generic terms such as discharge, generalized weakness, return to skilled nursing facility, pain, no ride, status post-fall, or other non-specific terms instead. The diagnosis must be precise. For example, left distal femur fracture. Also, if the patient had abnormal labs, specify what was abnormal and the associated signs and symptoms. For instance, the sending facility should write down low H and H lead to debilitating globalized weakness. This would be an appropriate diagnosis and support the medical necessity for transportation. The middle section should be completed based on the patient's acute condition. The facility will simply mark what applies. For bed confined, select yes or no on the right side. You'll see options labeled 1, 2, and 3. If the patient meets these criteria, they are considered bed confined. Even if the patient is not bed confined, they might still be a fall risk. So if they are, please have the facility mark in the other section they are a fall risk now. Let's turn our attention to the middle section. Check all applicable boxes for conditions such as oxygen use, ventilator dependency, central line presence, aspiration precautions, or special positioning needs. If a necessary condition or device isn't listed, use the Others section to document it. Now, moving on to the Critical Information Medi-Cal Patient section, this must be completed for all patients, regardless of Medicare or Medi-Cal status. The patient may be under Medi-Cal through a different plan, so ensure all applicable information is accurately recorded. This section is one of the most common sources of errors, often requiring corrections. Anytime a patient comes from the ER or is a medical patient from the floor, this form must be completed by a physician. The required information includes the physician's full name, example John Smith, the facility's phone number, not necessarily the physician's personal number, the date of service, the physician's signature, and the physician's medical license number. We understand that obtaining a physician's signature can sometimes be a challenge, but it is absolutely essential for all Medi-Cal patients. If the patient is not a Medi-Cal patient from the floor, this form may be completed by an authorized representative, such as an RN, discharge planner, or case manager. When completing the form, ensure the following information is clearly legible from the authorized representative: their first and last name, their signature, their facility phone number, and the date. Now the example at the bottom shows common mistakes. As you can see, the name is not legible, the signature does not match the authorized representatives, and their credentials are missing, although the phone number and date are correct. We hope this breakdown clarifies the PCS or CMN form requirements. Do your best, and if you have any questions, don't hesitate to reach out to our training department. Thanks for your attention.